continue to actually get worse. I know that's hard to believe, and that's in terms of the sounds of that, not good. But when we want to turn things completely over to the federal government, who is completely inefficient, and again, let's be reminded of the fact that the clinicians that you see are being regulated and being told by insurance companies and those that are federally based, so Medicare and Medi-Cal, what should be done with regards to assessments and tests. And based on that super generic and generalized medical billable code diagnosis, how many visits and how much treatment should be done, and what treatments should specifically be given to the individual. So we need to return healthcare to the creative and forward-thinking clinician to make patient care great again, because it is far, far from that. We're talking about major things being missed with regards to cancer and aneurysms that are not being picked up and screened appropriately by clinicians because they're not spending the time, they're not playing the game. As a clinician, you need to play the game. You know that, we know that what we're being looked at in terms of underneath the magnifying glass and who we're being looked at by clinically with regards to regulations. Play the game, know the words that need to be said. First and foremost, be ethically and morally responsible and look out for the best interest of the patient. Tell the truth via your dialogue. Spend extra time, dictate. There's things that can creatively be done that puts the patient first and foremost. This is why you got into doing what you wanted to do and what you're doing anyways, because you love and care for people. Take the industrious approach and doing things differently and acting, thinking, rationale, using rationale different than others, not fitting into that evidence-based practice mold that loses the customized approach of the human being. We're taking the authentic identity of the human being, almost literally like stripping human beings of their fingerprints and their footprints and saying, hey, you're just like everybody else. You are that little gingerbread cookie cutter. You have medial lateral epicondylitis. Well, everybody else that has medial lateral epicondylitis or knee pain or hip pain or patellofemoral syndrome get the same thing. You with your cervicalgia, which 5,000 different reasons is why you could have cervicalgia, which is the nerd word for neck pain. Lumbago, which is low back pain. 5,000 reasons as to why you could have that, or patellofemoral syndrome. 5,000 different reasons as to why you could have that. We need to be very specific and very loving and very kind and creative with regards to what we're giving the patient. Patient, you need to know that it's your right and your responsibility to ask questions and to be highly involved in the healthcare system and in managing your healthcare. It needs to make sense to you as well. You need to ask questions. If you have a clinician that gets upset and frustrated with you for asking an authentic and a genuine question because you care and you want to make a difference in your own life, that's not someone that you should be seeing. You need to sift through and sort through, ask friends and families and through social media, look into who's providing good and great care for what you potentially have going on. You have to be active. We have to do a better job of being more active today in managing our own health care. You are better and more significant than a billing code, than a medical diagnosis, and then a rehab diagnosis. It is owed to you being an unrepeatable human being made by your maker, much different than anyone that will roam in and amongst the history and existence of the world and the earth, anything quite resembling what you are. Important decisions to be made on November 8, 2016, which will find the results and suffer or rejoice in the judgment of the human civilian of the United States of America late on November the 8th or early November the 9th after Election Day. If you're concerned about healthcare, for you, your family, and the direction that it's going, you need to know that we're capable of and should be able to make decisions about our own care independent of government regulations, in collaboration with skilled and very integrated clinicians that have your best interest at heart and will provide you the best prognosis for your treatment and your care. You need to realize that the federal government is significantly inefficient with how it deals with anything. You also need to know that there's a lot of good clinicians in San Diego and all of the United States that are jumping ship from the traditional realms of federally mandated and regulated type clinics, and that are branching off and putting together their own little practices in which, hey, you can pay $1,800 to $2,000 for a yearly service. They'll still accept your insurance, but you're responsible for paying X amount of dollars per treatment session, etc., with your insurance company picking up whatever. Which ultimately, in the long run and in the short run, depending on the severity and the significance of your pathological state, can be, will be, and should be in your best interest to check into. We, the American people and citizens, are very creative individuals, and it's our duty to continue to push forward into the new frontier, to be extremely innovative. We need to make innovation for clinicians great again. We need to realize that it is not lawful, nor is it right, to pay for, which an escalation in our premiums again, go towards paying for refugees, non-citizens of the United States of America that get better health care than any and all of us, and that get it free. That is mandated via the Patient Protection and the Affordable Care Act, which we know as Obamacare. We need to have open borders for health care and health insurance. There needs to be competition so that there's not monopolies, so that companies can't jack rates through the roof, and then mandate to clinicians what they need to do to get more physical therapy, physician's assistant, MD or DO visits, treatment sessions, etc., for the specific pathological state and pathology that you have. We need to make America great again, and in healthcare, that starts with Donald J. Trump. You need to stamp your ticket for Donald J. Trump for the sake of your family, yourself, your community, your fellow people. As clinicians, we need to make education with regards to the healthcare system and the process, disease process, pathology, like process, and managing healthcare and overall health and wellness great again.